High blood pressure and elevated blood cholesterol are silent killers. Each can substantially increase your risk for heart disease and stroke, and they are both easily treated. Our guest on this week's Health Talk will tell you what you should do as well as what you should not do if you have high cholesterol or high blood pressure. So stay tuned. Health Talk is up next. Hello, I'm Dr. Eric Baser. Today our topics are high blood pressure and elevated cholesterol, both very common issues in our modern culture. My guest is Dr. Amy Lohman. She's a family medicine physician with New Canaan Primary Care. Amy, welcome to Health Talk. First time. You've been here a while, and this is only the first time we have you on.
Thanks for having me.
It's so good to have you. These are sort of the bread and butter issues for adult medicine: high blood pressure, high cholesterol. These are diseases that really have substantial impact on our long-term health, and yet are largely asymptomatic when they cause all the damage. So tell us, what are some of the modern thinking? Let's start with high blood pressure. What are the modern thinking about what is it, how to treat it, who gets it, all that stuff?
Absolutely, yes. And you made a great point there. It is a silent killer, and it is something that we encounter frequently in the clinic, where an individual will come in, whether for a physical exam or another problem, and their blood pressure is elevated. And they feel great. They feel fine. Hey, doc, I've never felt better, but their blood pressure is high. And so the old idea of nosebleeds and dizziness and headaches from high blood pressure, probably not true, or at least not for most chronic high blood pressure patients. Correct, not always. Yeah, if it's extremely elevated, we will see some of those symptoms, absolutely. But for the vast majority of what we see in the clinic, it is largely asymptomatic, and we will address it when we see it.
So I know we all talk about numbers. Tell us a little bit about the numbers in high blood pressure. And I think they're changing a little bit, or also maybe a little bit different about how old, depending on how old you are.
Correct, exactly. So a few years ago, the recommendations did change. We do like to keep the blood pressure below 140 systolic, or the top number, under 40, the bottom number. And being a little bit older, so
140.
So 140 over 90 or less, yeah,
okay.
Correct. Being a little bit older, meaning over 65, they do give a little bit more leeway in terms of the blood pressure could be a little bit higher. And the thinking is that an individual's body is used to it, and we might be able to get away with blood pressure that's below 150 over 90 instead.
And arteries get a little harder as you get older.
Correct.
And they're less compliant, and therefore the blood pressure, the top number in particular, goes up a little bit higher just because of the physics of that change.
Correct. Exactly, yes.
So you have a patient, let's just pick a 35-year-old patient, slightly overweight, walks into your office with a blood pressure that's, 155 over 95 or over 100. What's your approach? This may be the first time you've seen that patient, let's say.
Right, so exactly, I would mention to the patient, say, hey, I noticed your blood pressure is a little bit higher today, let's recheck it. Sometimes people are a little anxious or nervous coming to the doctor's office, so their blood pressure will be a little higher on the first check. And many times, especially in someone who's young, their blood pressure will come down if we recheck it. Once they're a little more comfortable after we've had a conversation, maybe they're not as anxious about the reason they came in there. And if it comes back down
so certainly
to normal,
anxiety can change your
absolutely,
blood pressure.
it certainly can, yeah. So sometimes we'll see it come back down to normal. But if it doesn't, if it stays elevated, the first thing I usually instruct the patient to do is actually get a home blood pressure cuff and start measuring it at home. When they're in their own environment, they can sit down for at least 10 or 15 minutes, which is ideal to get a good resting blood pressure at home. And if they find that their blood pressure is consistently elevated, even when they're comfortable and resting at home, then it's time to call me back and we start having discussions about treatment.
And even this is a change from the way it used to be. It used to be a couple of blood pressure readings in the doctor's office and you'd start therapy. I think we've learned the value of monitoring the blood pressure at home and being sure that it's not just a reaction to the doctor's visit. Or exercise. If somebody climbs a few flights of stairs to get to your office, it can. Yeah, a lot of people don't realize that the blood pressure fluctuates literally minute to minute based on your exercise and everything. And so we're just taking a snapshot of it, and you really want to know that it's chronically elevated.
Precisely, exactly. Yeah, a lot of times patients will say, I'm checking my blood pressure at home. it's elevated when I first check it, but it comes down to the normal levels. And that's okay, as long as you see it coming down. But if it's consistently elevated, that's when we do need to take some action.
How about stress? Is somebody who's chronically stressed, does that raise their blood pressure chronically? Is that
Chronic stress is actually absolutely
So
a large risk, yes.
So you can actually give yourself high blood pressure.
Certainly could.
If you're stressed a lot, especially
Yes.
some of the high achiever people could certainly do that.
Absolutely, yep.
So you've established that this 45-year-old man or woman has high blood pressure. Again, what's the next step? You've had them do the home monitoring. They're still elevated.
If it's still elevated, they come back to the office, and then we can start to have a discussion about lowering the blood pressure with medication. So, you know, we typically use one of the most common ones that have been around. We talk about the side effect profile, and that's just it. We start the medication there, and obviously talking about lifestyle, because that's a huge reason blood pressure is going up. So we talk about things like stress, anxiety. We talk about things like what are they eating on a regular basis? Are they physically active, getting regular exercise? And if not, we would talk about starting to incorporate those things into their
obesity
lifestyle.
in and of itself, it actually has two effects. And one is if you use the wrong size blood pressure cuff, it can artificially give you a high blood pressure.
Correct.
But then it, in and of itself, can cause high blood pressure. So,
Yes.
so how often are you, I mean, lifestyle seems like such an attractive, diet and lifestyle, such an attractive way to manage, a natural way to manage high blood pressure. Also, extraordinarily difficult to really change things on a chronic basis. How often do you see diet and exercise permanently change blood pressure?
I do see it if an individual is really committed to it, and I think that's really key, is really making a day-to-day decision to make those lifestyle choices and changes. And in someone who's really busy, is a busy family or work schedule, you know, sometimes it's really hard to make those changes permanent. And so what I'll do is I'll say, let's trial the medication, let's get your blood pressure to a normal number so that you can reduce your risk of strokes, heart attacks, other causes of elevated blood pressure. And then we can talk about incorporating some of those things more consistently.
Well, that's interesting. So you go with the
into your
medicine
lifestyle.
early rather than, let's say, lifestyle and
If
weight
someone
loss.
feels very strongly about wanting to make those changes and they're very motivated, then absolutely I will let them, you know, do a trial of lifestyle change first. Yeah.
So in medicines, just say a few words about, there's really a whole panoply of different medicines that are available to control blood pressure. And I know that we can vary these based upon side effects, the individual, even the potential cause of the high blood pressure can be varied. So just say a few words about them and what kind of side effects are the most common, and what do people worry about taking some of these medicines?
Yeah, some people worry about, you know, some of the side effects. You know, a common one that we use is ACE inhibitor. Lisinopril is a really common example of that. The most common complaint and reason people might want to change is because of a dry cough that comes with it. So that's a common reason to change.
Common, but it's what, 8 to 12%? Something.
Yeah.
It's not an overwhelming.
Not overwhelming, but it is the most common reason people come back and say, I don't want to be on this medication.
But that's important for the patients to know too, because I've seen patients who have chronic cough and their doctor doesn't recognize that it's due to the ACE inhibitor, the lisinopril, or the R blockers. So I'm sorry, I don't want to talk technical. The angiotensin receptor blockers, which work on the same pathway as the ACE inhibitors, they don't have that side effect, do they?
No,
So you
not
can
as
substitute
readily.
one
you
for
could
the other.
substitute, exactly. And that's oftentimes what we do if someone has that side effect with an ACE inhibitor. So those are other common medications that we use. Hydrochlorothiazide is a common one.
Mild diuretic, been around forever.
Exactly, yep. And typically the diuretic effect is short-lived. You know, most people will say, I noticed it at first, but then it kind of dissipated and they don't really.
It really works by depleting a little bit of extra salt in your diet.
Correct, yeah.
Do you give strict salt restriction for most people?
I talk about diet in terms of reducing salt in processed food. So really cutting out, you know, things that you wouldn't necessarily buy in the produce aisle, but things that are boxed, canned. Those are really high sources of sodium in the diet, where people will say, I don't add salt to my diet or my food, but they're eating things that are intrinsically salty. Yes, pickles is a great example.
Pickles are salted.
Yes, intrinsically salty. Cheese is another great example.
I didn't even know that.
Salty. So, you know, it's just really identifying those items in the diet that they can substitute for other and healthier things.
That's how high blood pressure is a chronic, oftentimes permanent disorder. And I think a lot of people think, well, I was treated for it, but I'm fine now. Could you say a little bit about the importance of recognizing that this may be a problem for your whole life and why it's so important to manage it?
Right, exactly, because it can cause things like heart attack, stroke, and that's really what we're trying to prevent. In primary care, it's all about prevention. Primary prevention, meaning we're really trying to prevent a first-time heart attack or first-time stroke. And then if someone has had cardiovascular disease or had those problems, it's the secondary prevention where we're trying to really prevent other, further sequelae of that problem in the future.
If someone says you have high blood pressure, you should see somebody intermittently, a doctor, a nurse practitioner, because this may be a problem for you the rest of your life. And I think a lot of people don't realize that the problem is that the blood pressure over time, damages your blood vessels.
It certainly does.
And that's what leads to the heart attack and stroke. And it can be a bleed, it can be a thrombotic or a blockage attack, but you don't want this slow damage to accrue. And that's why if you have it at 40 or 35, it's so important to treat that for the indefinite future, or control it, let's say, for the indefinite future.
Correct, absolutely. And we also see chronic kidney disease from that too. It's the same pathway. It's damaging the arteries leading to the kidneys. And over time, we start to see that in the blood work as well. So there's, all these.
Yeah, so blood pressure is it's a big deal. And unfortunately, the surveys I've seen is that way fewer numbers of patients are actually appropriately managed than should be. This is a medical success, and yet we don't have everybody under that umbrella. We have a couple of minutes left, not enough time, but let's talk a little bit about cholesterol. Everybody's heard about cholesterol. Tell us a little bit more about managing high cholesterols.
Right, so it's another reason to come for an annual physical exam where we check your cholesterol. That's where really we identify elevated cholesterol in the blood, because again, it's asymptomatic. Someone may not know that they have elevated cholesterol until they get their blood drawn at a physical. And then we really start to talk again about those lifestyle modifications that we can see changes in the cholesterol. And we also talk about other risk factors. Do they have diabetes? Do they have high blood pressure? Do they have a family history of heart disease? And those would be other reasons that we may need to lower cholesterol through the use of statins.
Yeah, the statins atorvastatin is the one that Lipitor that people know about. There are so many others. They all work through the same pathway. They are, in my mind, miracle drugs. They came out during my earlier career, and they have a fantastic effect at preventing heart attacks and strokes. They're fabulous. And again, there's a misperception out there that if I don't eat a lot of fats, my cholesterol is going to be fine. And I had a very dear friend who was a lipid expert and did a lot of these early national trials. And diet, he said, only about 15% of the patients were diet sensitive, that you could really manage their cholesterol on diet. The rest of it, you got bad genes, folks. And we have a medicine that works fabulously. So I've been taking one of these medicines since age 40. I'm 72 now, and I've never had a vascular issue in my life. My father actually had his first heart attack at 55. So now smoking goes along with this too, and we don't have time to talk about that. Yeah. But I just can't emphasize enough how successful modern medicines are at controlling cholesterol.
It's so true. You're absolutely right. And those statins are really key in preventing the primary prevention of first-time heart attack or stroke.
And there are ways, people complain of cramps or things. These are manageable side effects, or you can try different drugs and find the right one that doesn't affect them.
Typically, if there is a side effect such as muscle cramping, we can find another statin in the same drug class that will work without side effects.
So these are two such important issues. You manage them all the time as a primary care doc. They're so important. We can help so many people this way. And I think that it's almost become too common that people don't pay the attention that they should. Unfortunately, we've run out of time. I really want to thank my guest, Dr. Amy Lohman, for joining me on Health Talk today. And thank you for watching. Please share your questions and comments with us at healthtalk@newvancehealth.org. We'd love to hear from you. We'll see you next week on Health Talk. And please get your blood pressure and your cholesterol checked and take care of that. That's something that's so manageable. Thanks.
Our fight against coronavirus isn't over. We still have to slow the spread and do our part. Let's wear face masks in public. Stay 6 feet or more from others. Follow state and local guidelines. Wash our hands frequently and stay home when we feel safe. For ourselves, for our loved ones, for our future. Let's move forward together. Learn more at coronavirus.gov.
Type 2 diabetes can have a big impact on your life, but how can it be prevented? Well, the first step is knowing if you have prediabetes, a serious medical condition that puts you at high risk for type 2 diabetes. 1 in 3 American adults has prediabetes, but more than 80% don't know they have it. The good news is, prediabetes can be reversed, and for many people, healthy changes in their daily routine can make a big difference. Take the 1-minute risk test today at doihaveprediabetes.org.
You know this already, but we can never emphasize it too much. Regular exercise and healthy eating are essential for your health. Our guest on this week's Health Talk will discuss the impact of exercise and good nutrition on achieving a healthy lifestyle. She'll also provide tips how you can incorporate these healthy activities into your life. So please stay tuned. Health Talk is up next. Hello, I'm Dr. Eric Mazer. Today our topic is exercise and good nutrition. My guest is Dr. Amy Lohman. She's a family medicine physician with New Canaan Primary Care. Amy, welcome to Health Talk.
Thank you for having me.
One of my favorite topics, exercise and good nutrition. It's so easy to do because you can make choices, and yet it's really hard to do.
Exactly, yes.
So maybe start off by telling us, why is exercise so, we haven't really known for that long that exercise is good for you.
Correct, yes, and exercise is very important, but yet, like you said, it's very difficult to do and do consistently, because that's actually key, is to have a good exercise routine in terms of preventing disease, chronic disease specifically, is what we're looking for.
So let's talk about exercise first before we go on to nutrition. I think some people think of exercise as gym memberships, or going to, Tai Chi classes every week. How do we make this part of our lives? What are some of the hints? I think all that is good. I know all that is good, but how do you make it more just a part of your existence?
Well, I think as a culture, we equate exercise with work, right? We say, I'm going to work out, but it really has to be something fun. You really got to find something that you enjoy doing and that's going to be sustainable on a long-term basis. What do you enjoy doing? Is it a sport? Is it, even just going for walks? Or find something you enjoy and that you're going to do consistently. That's the most important.
So it's really finding, how do you get from couch potato to something you enjoy? Because I think, again, there's this hump, this hurdle you've got to get over to find something you enjoy. I think people, especially as you get older, I actually was going to ask this too, you hurt more as you get older. Things hurt. Your elbows hurt, your back hurts, your knees hurt, and there's a little bit more inertia because of that pain. How do you get from there to where you're doing things well?
Right, yeah. So sometimes it's just starting out slow, just going for a walk around the block, see how you feel. And then think about things you do enjoy doing. Is it a sport that you like to do? And if you can't do that, you're not able to, find something similar to that that's really going to kind of keep you in the movement game, because that's really all it is. It's about moving, and it's about moving consistently.
And I know a lot of people will use pools if they have trouble with their knees, perhaps swimming as an alternative, or even exercising in the pool where you don't have quite the same weight on your knees.
That's a great option, absolutely.
And you mentioned walking. We have the opportunity to walk a lot more in our life than we really do. How do we fix that? How do we walk more without it being a big deal?
Yeah, we often say we don't have time. We don't have time to go out. But even if you have 5 minutes or 10 minutes to go out once, twice, or 3 times a day, that would be amazing. If you could do 30 minutes a day total, even if it's broken up into 10-minute segments. You just
said that, and this is important because I know this was just recently studied.
Yes.
Because for a while that we thought, well, you've got to do 20 minutes or 30 minutes of continuous exercise, get your heart rate up and keep it up for a certain length of time. And then there have just been recent studies that say, no, if you just break it up into little pieces and get that 30 minutes in snatches rather than in one continuous period, it still counts. It still is effective.
It certainly is, yep. So just finding time, whether it's on your lunch break at work or maybe a few minutes in the morning, in the evening, before bed, just finding time just to do something, to move.
How about those watches which count steps? Have you had patients do that, and have they found those successful?
Sometimes those can be motivating, absolutely, because it's a visual cue to say, hey, I've gone this far, let me try to get those 10,000 steps in. And that's a great thing, and it goes with your phone. You can look on your phone and see how many steps have I gotten and how far do I have to go. It can be a great motivating factor.
And the other thing I just wanted to point out, there have been periods in my time I've been very successful. I would not say this is the heart of that time, but periods of time where I have lost a lot of weight and very successfully incorporated exercise in my life. And some of the things that I found very useful, just parking a little further away from wherever I'm going and using the stairs rather than the elevators. It's a little bit of exercise, but it's really easy to incorporate it into your day, and it doesn't really take much more time, and it's real exercise. So let me throw that out as an alternative.
Absolutely. Those are great things, and if you're seated for most of the day, if you have a desk job, just maybe standing up and getting a stand-up desk.
And I know a lot of people have done that with the stand-up desk, and that makes a difference.
Even that is, you get a little bit of movement in your legs as you're standing, and it encourages you to walk around a little bit easier because you're already standing.
And you don't have to be a great athlete to do any of these things. In fact, you don't have to be an athlete at all to do these things.
Nope. No athletic experience required. Just move.
Just move.
Yeah.
And I think we have to understand in our evolution, we were created to move. We were field animals jumping around in the jungles or whatever. And so movement is really part of our lives, and our bodies are meant for that.
Absolutely.
And so I think that we really lose a lot. And the other thing that I know happens, and this happens a lot as you get older too, it's either use it or lose it. The body becomes weak and painful very easily. I know that just 2 weeks in bed and someone can be remarkably deconditioned.
Yeah, absolutely. Not even 2 weeks, a few days in the hospital, and individuals will be discharged.
And my wife is just coming off a fractured ankle, which we got skiing, so we were being actors. But she was in a boot and a cast for 8 or 10 weeks, and it's taking a lot of work for her to get the strength back, because there's so much loss of strength, and it happens very quickly. So
it certainly does.
You just want to keep maintaining.
Just keeping that consistency going. Like I said, even if it's 10, 20 minutes a day is all you can muster, just do that. It's better than zero.
And again, it doesn't have to be a big thing. Walking, you mentioned walking. Walking, I know, has been shown to be a very effective exercise. You don't have to be breathless.
And all you need is a good pair of sneakers, really. You don't really need much to do it.
And again, we're in a nice time of the year. It's easy to get outside. Swimming, for those of you that like to swim. Walking around with your baby. You can jog with the baby carriages. There's a lot of opportunities. And I think a lot more workplaces are beginning to incorporate opportunities for exercise, aren't they?
Yeah, they certainly are. A lot of workplaces have gyms. They have treadmills or stationary bikes. That's a great opportunity for movement, and they're offering stand-up desks as well. So.
And the other thing I just want to ask you about is there are several exercise devices that are now coming with access to motivational classes. And you see them advertised, from stationary bicycles to shadow boxing or whatever. You want to say a couple of words about that? I think they're probably my kids use them, my grown children use them, and they find them very useful.
Yeah, it's whatever motivates you. If that's going to be something that motivates you, just having that bike or that treadmill downstairs waiting for you, and it's easy to get to, all you got to do is go downstairs to the basement, then by all means, I think that's great.
I think particularly if you're self-conscious and you're beginning and you're overweight, you're afraid to go to a gym because you don't want somebody to see you struggle. I mean, this is a perfect solution where nobody sees you.
Yeah, absolutely.
And yet you have the encouragement of and some of these are even live from what I understand.
Right, yep, you can get live coaches just streamed into your basement, and that can be great, a motivating factor also, and they don't necessarily see you either, so if you are self-conscious, that is another good opportunity to start moving.
So movement is great. How about diet? Let's talk a little bit about diet. What's wrong with our diet today?
Well, it's a lot of processed foods, so it's a lot of things that come in boxes and cans, and not enough things from the earth or that come naturally. So, we really like to emphasize, and you've probably heard this before, but really lean proteins, vegetables, fruits, and I know we probably heard it all our lives, but I can't emphasize it enough that that's really the most important thing is intake in terms of preventing disease maintaining a healthy weight.
Let me ask you about meat and eggs. For a while, they sort of were this staple of our diet when I was a little kid. Then they went through a period where they're high cholesterol and you want to avoid them like the plague. And I think the pendulum swung back a little bit towards having them as a part of your diet. I don't not say it's but do you want to say a few words about that?
Yeah, absolutely. You know, we used to think eggs were bad for our cholesterol, and we found lately that they're probably not as bad for our cholesterol. They do contain a certain level of cholesterol, but the American Heart Association says it's okay if you want to have 7 or 8 eggs and you're incorporated into your diet over the course of a week, and that's probably not going to raise your blood cholesterol to a significant extent.
Yeah, and I think we discussed this before, but just your diet determines your cholesterol only to for most people only to a small extent. That the few people are very diet sensitive, but most of it is your genetics, and therefore, you know, again, steak should be not 3 pounds 3 times a week, not 3 pounds 5 times a week, but you know, a 4, 6, 8 ounce. 8 ounce may be high. That's where I am, but 4, 6 ounce portion of meat is great.
It's probably fine. Absolutely, yeah. So if you're a steak lover, a steak eater, go ahead and incorporate a little bit of steak into the diet. That's okay.
So it's not, you don't have to cut off from all of these foods, and you can eat very creatively.
Absolutely. No, you're absolutely right. And it's all about, you know, keeping in that moderation and not going overboard in one direction or another.
Any foods that we should be avoiding? You mentioned the highly processed foods. So that's anything that comes in a box or a can? Typically,
yeah. You know, a lot of things that come in boxes or cans, kind of in the middle of the grocery store, the supermarkets, have a lot of high sodium or highly carbohydrate, or add a lot of sugar into those products.
Yeah, one thing I was surprised about is that some of the hamburger buns by the most famous fast food hamburger joint have a lot of sugar in them,
They sure do.
which I didn't realize that.
Yeah.
But you know, they add, that's why the buns taste so good.
No, it's true. But yes, they are highly processed. They have a lot of sugar, and that will subsequently raise our blood sugar levels as well, and cholesterol.
How about fiber? That's gone through a lot of iterations too. Having fiber in your diet, is it still recommended, and why? And how do we get that?
Yeah, absolutely. Fiber is an important part of the diet, and that's where those whole grains come in also. You know, incorporating, you know, whole grain, you know, breads, instead of choosing, you know, breads that are more highly processed. You know, the white breads we typically try to avoid, but you know, the whole grains are the much better option to keep that fiber in the diet and to keep our GI system regular.
And we hear an awful lot on TV today about food supplements, dietary supplements, vitamins. How do we fit that in? I think it's a $1 billion plus injury. I said injury. It was a Freudian mistake. Industry, but you know, not every nutrient is bad either. So what's your thinking about that?
Yeah, absolutely. You know, there's absolutely nothing wrong in taking a multivitamin on a daily basis, but the studies have shown it doesn't necessarily extend our lifespan, but it can help fill in gaps in the diet that we might be missing, you know, and it's not, you know, it's not a problem, but is it really going to help us or replace those healthy foods? No.
And I think that there are some things that I think are not scientifically based that bother me actually quite a bit, because they've become big industries, and I think they take advantage of people looking for health in a pill.
Yeah.
You know, I think there's some vegetable and fruit products in a pill that don't make scientific sense. I think there are things to change insulin resistance, pills to change it, which don't make sense. As you said, if you want to take a multivitamin, if you have to take something, it doesn't have to be an expensive one.
Right.
Take one and then there are vitamins that sometimes your doctor may prescribe, like calcium and vitamin D. Some people in the north, you know, we up here in New England may need vitamin D a little bit in the winter, but those are not terribly expensive.
Exactly. Yeah, you're right. You made a great point in that a lot of these are expensive, and they shouldn't really be replacing our diet and exercise habits. So even though we don't like to think about what should I change in the diet, it's easier just to take a pill, take a supplement, but really it comes down to just
the supplements are not going to replace or correct a faulty diet.
Right.
You really just need, and unfortunately that's all we have time for. I want to talk about berries for dessert, but I ran out of time. I really want to thank my guest, Dr. Amy Lohman, for joining me on Health Talk today for a very instructive discussion, and thank you for watching. If you have questions, please share them with your comments with us at healthtalk@newvancehealth.org. We'd love to hear from you. We'll see you next week on Health Talk. Eat well, exercise, and take care of yourself.